Hello, my name is Dr. Jose Luis Ruiz, and I'm the director of the Los Angeles Institute of Clinical Dentistry. And it is my pleasure to share with you this Dentistry Today Technique of the Week video. And the subject couldn't be any more important: occlusal adjustment of a single tooth after a restorative procedure. There is no question about the fact that if we miss the occlusal adjustment, we will, without a doubt, have bad consequences. One of them is post-op sensitivity. A lot of our patients, they have a filling or a crown, and we think that maybe it was the bonding system of the cement. It's in fact just a simple lateral interference, and they could be with sensitivity for a long time. And of course, we know that that's not good for our practice and for our, for our good relationship with our patients. Also, if we don't adjust correctly our onlay or our crown or our filling, we could end up with a fracture. And that's also very bad. And of course, we know that the number one reason why the teeth will fracture, or the filling would fracture, the restoration will fracture, is the bite. If the patient didn't bite, it wouldn't break. If the patient didn't grind or didn't have parafunction, our restoration wouldn't break. So it's key to success to make sure that we adjust it correctly. And by the way, let's not assume that because we're using zirconia or gold, we don't have to worry as much about proper occlusal adjustment. This is an excellent example on your screen. You can see a dentist who had 2 gold onlays done by the head of profs of the local school, and she had sensitivity for a year and a half, and it got to the point where she had already been referred for root canal on the tooth. And in fact, when she came for a second consult, we discovered that it was just a lateral interference, and it didn't take me more than a few seconds to adjust it. And using the technique that I will share with you next, we were able to get her completely out of pain. So this couldn't be any more important. Now we're going to talk about the step-by-step of the occlusal adjustment. The first, let's remember the patient is already in a supine position, and a properly trained dental assistant is going to immediately give us cut and roll so we can start isolating that tooth. Isolation is very important because we use thin articulating papers, Artifold from Bausch, Accufilm 2 from Parkel, and they require a dry environment. If we use those wax articulating papers, they're very inaccurate. The first step is going to be to check for centric contacts with a blue articulating paper. And the instruction to the patient is going to be, tap your teeth together like this. Tap, tap. I want to make sure that I show them with my hands so they understand what I'm talking about. Tap, tap. Never say bite, because if they bite, sometimes it will activate the masseters, and they can very easily break a high filling, a high composite, a high piece of porcelain. We should see equal contacts on all the teeth. We should see that the contacts are on the working cusp, on the central groove. After that's done, then we will check for lateral interferences, and we will use a different color paper because we know that the mandible moves in the direction of the food when people is chewing. So we will ask the patient, the instruction to the patient is going to be bite and grind your teeth. I show them with my hands, and I show them how I want them to grind their teeth, and I tell them, bite like you're biting a piece of jerky, and exaggerate your grinding sideways forward. If there's any red outside of blue, it's an excursive interference, a lateral interferences, working, not working, it doesn't matter, has to be removed. Any red outside of blue has to be removed. So when we're done with this adjustment, we should see blue and red right on top of each other. And it has to be with 2 color papers. If we only use 1 color paper, it's not going to be possible. The last step is seat the patient straight up and down, and do this one last time very quickly, just to make sure that there's not a slight difference because of a postural difference. And after that, we'll be done. Now, this technique can be also used for patients that have severe sensitivity or even pain on a tooth, like the case that you see on your screen. This patient has severe sensitivity, and she had already been treatment planned for a root canal at another office. And after I checked for occlusal trauma, I immediately discovered that she had a lateral interference, and that pain went away immediately. Occlusal disease is rampant, and our patients are destroying their teeth with their occlusion. As you can see on this slide, The patient to your left has healthy occlusion, and the patient to the right has occlusal disease. And you can see the severe destruction, and the incredible thing is both patients are the same age. So it is important that we diagnose predictably, consistently our patients that have occlusal disease and not wait until there's so much destruction. Using the technique of the 7 signs and symptoms of occlusal disease is very valuable, and there's a lot of information out there, articles, videos that I have published, and it's important to treat our patients and diagnose our patients. Educating our patients is key to success, and for that reason I would like to share with you a wonderful free video that Los Angeles Institute had developed to educate patients. And this video will allow you to show them to your patients, and they will understand occlusal disease and understand why they should have some treatment, starting from a night guard and going up to occlusal equilibration or rehabilitations. This is a valuable tool. It's been my pleasure to share this information with you, and I hope you have a good day.